Welcome back to our next tutorial video. This is exercise and the heart. So we are looking at exercise physiology, and the heart and how that is put together. So let me pull this up for us here. This will be part of the full exercise physiology lecture that I will record later on. But here we're going to look at the specifics of the cardiovascular system and exercise put together. So what we see with exercise, obviously, that is going to be a rise above the existing resting heart rate that we have. So our heart rate is going to be rapidly increasing upon onset of exercise. That rapid onset is going to be a reduction of vagal tone, which the vagus nerve is usually going to be a parasympathetic input that is going to diminish the conduction rate of electrical impulses that are causing heart rate to be lower. After the onset of exercise, we have an increase of heart rate until cessation of exercise. So roughly 3 to 5 minutes after exercise has completed, we have a decrease of heart rate back down to its resting level. During heavy exercise, we see that there is a tachycardia that occurs, which is a higher heart rate than should be normally advised. And that is because of a reduction of vagal tone and the addition of the activation of sympathetic nervous system. So we have catecholamine induction here with the suppression of vagal tone, put those together, and that is going to cause an extremely high heart rate value. So if we have an extremely high heart rate value, that means that our recovery time is going to go up to a larger degree, right? Several minutes, 45 minutes, an hour, possibly. So the limit for sympathetic activation is going to be down to the individual. If we have a high level of stress or a high level of output, that sympathetic innervation can be massive. So on average, if we see exercise with 50 to 60% of the maximal oxygen consumption or the maximal oxygen volume that we can take in, that is going to cause sympathetic activation. So if we have a heart rate, let's say we get our heart rate up to 120, 125 beats per minute, and now we have started to ventilate at around 50 to 60% of our maximal oxygen consumption, we will have sympathetic activation. So for the cardiovascular system, what we are going to look at as far as cardiovascular health and exercise is to target heart rate zones, right? So we can estimate a maximal heart rate and then try and estimate the zone of heart rate that we want for a particular exercise. So when we're estimating heart rate, there's a couple of different methods we can use. The baseline method that is used most often is going to be 220 minus your age, and that is going to be a maximum heart rate that you can use. That's going to be a little bit off. It's not exact, right? So we're estimating, we're not measuring it. It's not an exact science. So if we have a 40-year-old person, for example, then their maximum heart rate theoretically should be around 180 beats per minute. If we're going to use the calculation, which is going to be 217 minus 0.85 times age, right? This one's going to be a little bit more accurate. It gets down a little bit closer to the exact value. Again, not completely exact, but close enough, right? This would be 217 minus 0.85. So let's say we have the 40-year-old person again, 217 minus 0.85 times 40, we get 183 beats per minute as a maximum heart rate. Recommended heart rate according to age for long-lasting exercise and maximal heart rate for short-lasting exercise are two things that we go with here. So the recommended heart rate for a long-lasting exercise is going to be around 60 to 70% of the maximum. For short, it's going to be about 85% to 90%. Heart rate changes in the recovery phase. In the first minute, there's going to be an immediate exponential decrease. So let's say if we're at 150 beats per minute, we will have an exponential decrease down to around 100 beats per minute within that first 60 seconds afterwards. The second minute is going to be a continuation of that, but it's going to be a little bit slower. The curve is going to level off a little bit. There is going to be an exponential drop in plasma levels of sympathetic nervous system neurotransmitters. So we're going to see a drop in epinephrine and norepinephrine precipitously in that second minute. At this time, we have destimulation of the sympathetic input, so destimulation of epinephrine and norepinephrine. That is going to lead to a reactivation of vagal nerve and vagal signals. So that is going to lead to a progressive reduction of sympathetic hormonal activities. That parasympathetic activation from the vagus nerve is going to be a vasovagal reflex, and that is going to cause degradation of heart rate further. So heart rate changes in the recovery phase are part of heart fitness, cardiovascular fitness. A quick recovery of heart rate or a quick downgrade of heart rate is going to be indicating good cardiovascular health. The longer it takes for the heart to recover and downgrade to a low resting heart rate, the poorer the heart's performance is. You can use Riffier's test here or Flack's test together. So for stroke volume and cardiac output, we see that if we increase stroke volume by about 20 to 30%, let's say from 80 to 110 milliliters at 50% maximum oxygen intake, this is going to be followed by a steady state, meaning that the stroke volume is going to be maintained pretty much the same regardless of how much heart rate increases. So the cardiac output is going to reflect heart rate increase and not stroke volume change. If we exceed a critical heart rate value, then we will start to see some drop in stroke volume. This is going to be a drop in the cardiac efficiency because we simply don't have enough time to fill the ventricles between heartbeats. So during tachycardia, for example, the shortened diastolic phase leads to not enough filling. So we see a decrease in the diastolic filling of the ventricles, and therefore the pumping efficiency goes down because the volume is just not as much. So our increase in stroke volume with exercise is going to be accommodated by an increase in end-diastolic volume as we see more blood flowing back into the ventricle for more blood being pumped out, and an increase in the ejection fraction, which is normally around 60%. This is going to directly translate back to the Frank Starling mechanism of distension of the heart wall, causing a larger increase in stroke capacity and contractile capacity. So the curve is shifted to the left and up, which is an effect of sympathetic stimulation. For cardiac output is the product of heart rate and stroke volume. So maximum cardiac output, let's say in a 19-year-old person or in a 25-year-old person, can be 19 liters in a young person, in a woman, and 25 liters in a man. For blood pressure during exercise, systolic blood pressure is going to rise sharply. This is expected because our heart rate is increasing and the stroke volume is also going to go up slightly. So we rise that sharply during isometric and sustained rhythmic exercise. And this is going to get it up to around 200 millimeters of mercury, far above normal resting. The diastolic is going to be maintained somewhat the same. However, it is going to increase slightly. The increase and decrease is going to be mainly due to the peripheral resistance and the vasodilation in the skeletal muscles. For the pulmonary, right, we're going to see that pulmonary stretch during isometric exercise, if we don't have a change in the stretch of the pulmonary system, we're going to see an impairment of venous returns. So that can cause a pooling of venous blood and an increase in venous pressure. For the distribution of blood flow, right, muscle blood flow at rest is going to be very, very little compared to what we see with maximum exercise. With working muscle, it's about 10 to 15 times more than what we see in the capillaries at normal resting rates. So a blood flow of 2 to 5 milliliters per minute could go up to 120 milliliters per minute, which is an extreme increase. We have neuroregulation through the noradrenergic system, right? This is specifically sympathetic epinephrine influences, right? Hormonal regulation is going to come because of decreases and increases of oxygen and other cellular components inside of the bloodstream. So we see a decrease in the partial pressure of oxygen, an increase in the amount of metabolites, right? A hyperosmolarity, all going to be sensed by receptors within the vasculature. For blood flow to organs, we will see the splanchnic circulation take into place here. So we will see a decrease in the blood flow through the splanchnic organs, which are things inside of the visceral cavity, such as the intestines, the pancreas, the liver, things like that are going to see a decrease in blood flow. It's going to be redistributed to the working skeletal muscle. So the visceral blood flow drops to only about 30% of its resting value. We will see that the cerebral blood flow is going to remain relatively constant. So even blood flow to the brain is going to remain somewhat the same. but the blood flow is going to be redirected from one part of a brain to another, specifically the motor output zone. So for bone, the blood flow to the bone can be increased by up to 40% in response to mechanical loading, especially during weightlifting and large mechanical tension. For our blood, during exercise, we will see an increase in hematocrit. That means an increase in red blood cell population inside of the blood while we are exercising. So viscosity will increase slightly due to high filtration of the plasma. We can also see leukocytosis through demargination. Mainly, we will see an increase in neutrophil and lymphocyte circulation, especially into the lymph flow, and we will see an increase in white blood cell count. Finally, with the blood plasma during exercise, we can see glycemia, right? If we have a short-lasting exercise, we can see an increase in blood glucose levels of up to 60%. For long-lasting endurance training, we can actually see an overall drop in glucose concentration, so we can actually go into a hypoglycemic state. For lactate, lactate is going to go up for more short spurts of exercise. After we see 15 minutes of lasting exercise, right, we are going to see up to a 15-fold rise of lactate in the bloodstream. For free fatty acids, especially during heavy, long-lasting exercise, you can see an increase of up to 4 times the amount that we see in a normal resting value for free fatty acid intake. All right, that is the cardiovascular system comparatively to exercise. Thank you for watching this tutorial. Please like and subscribe to the channel. Also the Patreon, patreon.com/twistedscience. Thank you all for watching. I will see you next time.